Good morning and welcome to our Paths 2 project Cybermentoring session. Today is October 27th. Those of us with the Paths project at Region 1 Education Service Center are so excited to have all of you here. We are looking forward to learning a lot with our partners, DHR Health, and today's session is on aquatic therapy. I want to welcome Mr. Agven from DHR Health. Just a couple of housekeeping notices for everybody. I'm going to have a place for you to sign in online so that we can keep track of who participates. And later on today, I'll be sending out the YouTube recording of this just to let everyone know that we are recording this. If you have any questions as Mr. Agven is presenting, you can put them in the chat or raise your hand and I can unmute you so you can ask the question in person. So I want to welcome everyone. We're very excited to have you here. And Mr. Agven, I want to turn the session over to you.
That was my key. Sorry. And good morning, everybody. My name is Will Agven. I'm a physical therapist assistant. I'm currently working in aquatic therapy at the Aquatic Therapy Institute at DHR. Let's see. So I'm going to show a person, so that way this can be a little bit more fun. Yeah. So as I mentioned, my name is Will Agven. I'm a physical therapist assistant at the Aquatic Therapy Institute. Sorry. As far as my education, I earned my physical therapy assistant degree from South Texas College in 2001. Earned my undergrad in psychology from the University of Texas Pan American in 2011. I was hired at DHR as a physical therapist assistant in 2014. Promoted to supervisor of Aquatic Therapy Institute in 2019. As part of that, I was certified in aquatic therapy by the Aquatic Therapy and Rehab Institute. I'm also a certified pool operator, and that certification I obtained in 2020. Now, prior to discussing what aquatic therapy is, really, aquatic therapy is just an intervention used by physical therapists and physical therapist assistants. Physical therapy, just for the record, it's the use of evidence-based kinesiology, prescribed exercises, hands-on interventions, specialized equipment, and education to improve the quality of life in an individual. Physical therapy can only be performed by licensed professionals such as a physical therapist and physical therapist assistant. Now, let's dive into what aquatic therapy is. Aquatic therapy is water-based treatments or exercise of therapeutic intent aimed at improving fitness, increasing disability, and restoring function lost due to injury or illness. The definition is very similar to physical therapy. But essentially, it is physical therapy. It's a tool that we utilize to achieve these goals.
Thank you. We can see your screen now.
Okay, sorry about that.
That's okay.
Yeah. So I was saying, aquatic therapy is a water-based treatment or exercise of therapeutic intent aimed at improving fitness, decreasing disability, and restoring function lost to illness or injury. The definition of aquatic therapy and physical therapy are very similar because, as I was saying, aquatic therapy is just a tool used by physical therapists and physical therapist assistants at improving function. Who can perform aquatic therapy? Aquatic therapy should be really be performed by skilled, licensed professionals such as physical therapists or physical therapist assistants, and it is performed in a specialized temperature-controlled pool. Now, who can benefit from aquatic rehabilitation? And that is pretty much anybody that would benefit from physical therapy. So any orthopedic condition, Alzheimer's disease, generalized weakness, spine conditions such as herniated discs, fractures, CDAs, aneurysms, any neurological condition. Yeah, so pretty much anybody. Now, I'm going to go over a little bit of the properties of water. Why is it that it tends to be what it is? Very, very therapeutic. Sorry about that. Very therapeutic, and why it tends to be a very powerful tool in restoring function in somebody that has been injured or is suffering from this. Now, one of the first properties that we're going to discuss of water is buoyancy, which is a force experienced as an upward thrust which acts in the opposite direction to the force of gravity. So it's that unweighing that you feel whenever you enter a pool or the ocean or anything like that. It tends to unload joints, relieving them of stress. So if you have a knee that has been injured because of jogging or anything like that, then just being in the water, it unweighs a lot of that stress in that joint. So if you enter a pool and you come up to your chest or shoulder level, you'll have about 90% of your body that gets unweighed. So it'll be 90% of your body that's off of that knee. Your mid sternum is about 75%. About your to your waist, that's about 50%. So it allows for the strengthening of that joint without the stress of your weight or a lot of shearing on that joint. Another property of the water that we utilize is the therapeutic temperature. We keep our pools between 92 to 95 degrees Fahrenheit. This warm water promotes relaxation of tissues, relieves pain, improves circulation. So after surgery and you experience that swelling, just being in the water without really being having any movement will improve the circulation, which will decrease that swelling and relieve that pain. So it tends to be threefold. Are there any questions so far?
No questions yet, but I want to remind everyone in the session that if you do have a question, you can either go to the chat and type your question there, or raise your hand. We'll monitor the participants. If we see your hands raised, we can unmute you so you can ask your question live. Thank you, Mr. Agven.
Thank you. Moving on, next property of water we're going to talk about is hydrostatic pressure. And that is the pressure exerted by a liquid in an immersed body due to gravity. Hydrostatic pressure increases in relation to water depth. So the deeper you are, the more pressure you have on the body. Now, this pressure, in reference to therapy, it increases circulation, decreases edema, decreases pain, increases range of motion, and it can potentially increase metabolic rates and caloric burn. So that pressure that you're having of that fluid on that part of your body that has been injured, or your whole your body as a whole, then your heart has to work less hard at trying to pump fluid through your body, improve circulation. So it's helping your cardiovascular system perform a little bit better. So if you spend about 45 minutes in the pool, it could potentially decrease your blood pressure for up to 4 hours. So that's a great benefit for somebody that suffers from blood pressure issues or cardiovascular insufficiency, or your cardiac output. It's not where it should be. Another thing, as I mentioned, the metabolic rates, it can also improve your renal function. So if somebody's having kidney issues, then that pressure, since it's improving your cardiovascular system and your circulation, then it eases some of the stress off of your kidneys, allowing them to work a little bit better.
Mr. Agven, we do have a question. We do have a question. How long has aquatic therapy been around? That the participants heard about it for the first time about 2 years ago. Is this a new therapy technique, or has it been around for some time?
So for DHR, yeah, aquatic therapy, for DHR, it was opened, our center was opened last year in July. But aquatic therapy has been around for many, many, many years. Actually, the aquatic therapy can actually be traced back to Roman era. And people would go and hang out at these bathhouses and talk politics and relieve stress, and be in these warm baths where they would essentially exercise and just let the water soothe the water, soothe their body. As I mentioned, just being in the water without really doing anything has a great deal of therapeutic value. Improves your circulation, decreases edema on the joint, decreases stress on those joints. So just by relaxing in the water, it's extremely therapeutic. But as far as therapy, like for physical therapy, aquatic therapy really hit a boom back in the 1980s, and started to become really, really popular.
Thank you.
Any more questions?
Not now.
Okay. Now, back to the properties of water. So water can also be used to offer resistance. So that's another property of water. So that we're utilizing for viscosity. I'm sorry, we're utilizing the property of water viscosity to offer resistance during an exercise. So viscosity in case some of you don't know what it is just a quality that describes the resistance of fluid to flow. So the more viscous a fluid, the less it'll flow. So honey has a very high viscosity rate, water, very low viscosity rate. right? So just moving in water, walking, simple walking in water.
Yes.
Uh,
Well done.
Bless you.
Sorry about
So just walking in water offers enough resistance to gently strengthen uh, the body of a client without offering a great deal of stress. Um, Another quality of water we exploit to offer resistance is surface tension or surface area. So the larger a tool is, such as what you see in the PowerPoint, and that young lady's holding that bar with the little blue bells or shells at the ends. Something like that will has a lot more surface area, which offer more resistance and allow you to strengthen that person a little bit more, as opposed to just using your hand, which has a smaller surface area and will offer less resistance. Now, drag force is another quality of water we utilize to offer resistance. As I mentioned, just simply walking in water is a strengthening action or exercise, right? So as you're walking forward in a liquid, right? Then you have a drag force which acts to kind of hold back or offer resistance to that body, right? So we use that. Also, if we're using a tool to strengthen like shoulders, an elbow, something like that, then the longer something is, and there we're talking about a lever arm, which is the distance between the axis to the point of action, the line of action. In simple terms, just the longer something is, the more resistance it's going to offer. The shorter it is, the less resistance it has.
Mr. Agven, we have another question.
Yeah.
Can aquatic therapy help increase range of motion?
Yes. So usually range of motion after, like, let's say, surgery or an injury, some of that range of motion is lost because there's inflammation to that joint. And then with time, you don't move that joint, then your muscles and your tendons and your joint capsule can start to shrink. But if we start early on, before we allow for that shrinkage, then just like I was saying, just being in the water will improve that circulation, which will decrease your inflammation and decrease your pain. Also, the warmth of the water will be very soothing to those tissues, those irritated tissues. So there, you'll be improving your range of motion gently in a nice soothing atmosphere. So, and that's one of the advantages that aquatic therapy has over land exercises. And land exercises, you really have to do a little bit more to try and achieve that that range of motion or that movement to improve that function in that joint or that person, because you don't have any of the qualities of warmth or decreasing that inflammation through to increase circulation. Does that answer your question?
Yes, I think it did. Thank you very much.
No problem. Now, one of the last qualities of water that we exploit is turbulence. So this can be achieved in different ways. Like if you have, as I mentioned, if you have somebody just walking in water, you can walk in front of that person and offer some turbulence by moving your hands, and that will increase um, the amount of resistance that that client is experiencing. Also, if you're working on balance and coordination, then you can have somebody just stand in water or stand on one foot, and you're offering that turbulence to improve balance, coordination, and with that improved balance and coordination, then somebody that is prone to falls will be much safer operating in their home. So you'll reduce that fall risk and make that person a little bit safer. Of course, the more balanced, better we are. Now, how does this play with, how do we utilize aquatic therapy in a traditional physical therapy approach? So let's take a specific diagnosis such as a herniated disc, right? So you have a herniated disc with low back pain and radiating symptoms. So typical approach to a treatment in the water, which kind of would mimic treatment in land-based, right? So we would do some traction, right? In the water, it's accomplished by, as you can see in the picture, attaching some weights to that person's ankles and then strapping some buoyancy belts. So that way the client is floating, but then you have the pull. It's a gentle pull of the weights on their legs, so they'll experience a traction or pulling sensation on their back. That will relieve stress on the involved nerves and relieve that pain or radiating symptoms. And just for clarification, radiating symptoms is when you have pain or tingling or numbness or anything like that that's really coming from the back, from a pinched nerve, and it's running down your leg or running down an arm, so that would be traction. After that, we would have the client sit on the bench in the pool and do some neurodynamic mobilizations, and that's just an attempt to try and glide that nerve through the muscles. Okay. When there's injury to a nerve, they tend to get inflamed, and sometimes they might stick a bit to a muscle. So gliding those nerves will free up that nerve, allowing them to work a little bit better, have less irritation, produce less symptoms. Also, after that, we would do some stretching to improve flexibility to those joints. The more flexible, let's say, your hamstrings are, your hip flexors are, then the less pressure on your back you'd have, and it would allow the nerve to heal better. And after
We
that,
do.
we'd want to
We have
stabilize.
another question.
Yes, go ahead.
What type of patients are the ones that would benefit from aquatic therapy the most?
Really, um, that's anybody. Anybody that would benefit from physical therapy would benefit from aquatic therapy. Um, really would be more concerned about what would not make you a candidate for aquatic therapy. So let's say you have open wounds, large open wounds, then putting in the water would be a risk because you'd be exposing that person to an infection. Even though the water is treated chemically to kill everything and anything that could possibly live in it, but it's never nothing is really 100%. So even if you have one little microbe that's just floating out there, but you have that wound, then you could potentially expose that person to an infection. So that person would not be a candidate. Anybody that has incontinence, unable to retain bowel or bladder control, they would not be candidates either. Somebody that has extremely low cardiac output. They would not be candidates either. Yeah, so we'd worry more about who would not be a candidate as opposed to who would be a candidate, because as I mentioned, anybody that would benefit from physical therapy would benefit from aquatic, or that specialization in physical therapy.
Thank you.
Yes, no problem. Going back to stabilization. So as far as the back, somebody that's suffering from back issues such as herniated discs or any other condition like that, stabilization is key to preventing further injury, for relieving symptoms, really for improving the overall function of that person. So the good thing about aquatic therapy is that pretty much anything and everything you do in the water serves to stabilize that person. So you could just be sitting there moving your hands or moving your legs or walking, and you're actively working to stabilize your body, because the water offers multi-directional resistance. So you're gonna experience resistance no matter what direction you move, as opposed to being on land. Then you have to have some form of external force to offer that resistance against you, which is what the water does. So that's a great quality of being in the water, of getting aquatic therapy when you're trying to stabilize the joint. Now, there's other, and that would be your traditional approach. Now we have alternative interventions that are not as widely used in physical therapy for aquatic therapy, but they're gaining greater acceptance right now. So the first one we're going to cover is Watsu, and we have a video so that you can see how intervention will benefit. So Watsu is sort of like stretching and body movements to promote relax, increase muscle tone. So somebody that has, for example, neurological issues, a stroke, that has a lot of tone to a limb, an arm or a leg, or somebody that's having back issues as well, and you have those muscles of the back. Sometimes you can have the muscles in the back being so tight and so active that they can offer a lot of stress, a lot of tension to the back. So this is primarily a relaxation. Give me a second. sorry about that. It looked like it were not embedded into the presentation, so they were able to play.
Oh, okay.
But that is Watsu. It's so like in the picture, you have the therapist cradling the client, and essentially they're kind of just moving them side to side, promoting a relaxation technique. The next technique we have, or we're going to go over, is Byrogas, and that one offers. It's more for proprioceptive neuromuscular facilitation, and there's somebody that, for example, again, when dealing with a stroke and they're learning to use their body again, so you'd be offering resistance as they're floating in water. To activate those different body parts. So here the guy or the therapist, I'm sorry, therapist is offering resistance to the foot. We'll be able to see the video. Then you'd see that he'd move on to activating the hamstrings, which is the knee, the quads, trying to improve function to that whole limb.
Just to interrupt a second, if you have a question, you can raise your hand. If you'll open up the participants panel, there's a place there that you raise your hand. We're going to disable the chat for now.
The Hollowic Method, it's another aquatic treatment intervention. It's also mainly used for neuromuscular education. And this one's also offering support at different parts of the body. And if I'm sorry, since you're not able to see the video, but essentially you have a patient floating in water with buoyancy belts, noodles, and you have the therapist offering support to a leg or an arm, which would kind of make you tilt in one direction, and the client would have to correct themselves to try and stay leveled in the water. So but you offering the parts, and it would in musculature to try and stay leveled or afloat. That would be the Hollowic Method. The Denko method, and I wish you could have been able to see this one, because this is one of the most dynamic inventions. And here, this method is designed to address like 6 properties: strength, flexibility, balance, coordination, endurance, and speed. So, for example, you could have a client on an buoyancy belt. Resistance fins would be added to their legs, and with some buoyancy belts. So you'd have the client normally jogging.
Excuse me, Mr. Agven,
Yeah.
we're having trouble hearing you. The audio's cutting in and out.
Is that better?
Yes, much. Thank you.
Okay, sorry about that.
No
So I was
problem.
mentioning the Burdenko method is more dynamic approaches, right? It targets strength, flexibility, balance, coordination, endurance, and speed. So you could have a client, you'd put on a buoyancy belt and then some resistance fins to the legs, and they could be holding some buoyancy dumbbells at the same time. And so you can have that person simulating sprinting or jogging or just simple walking or going from a upright position to a laying down position in the water. And it's very dynamic treatment approach. We tend to reserve this one more for the people that tend to be much higher level, that are getting ready to go back to normal everyday activity, or they want to get back to a sport, or they want to go back to their previous physical level of activity. Next, I'm going to show you guys our pool, the Aquatic Therapy Institute. So our current pool has 5 different depths, which is 3.5, 4.5, 5 foot, and 6.5 feet. It's a nice size pool. Yeah. Now, as I was mentioning, aquatic therapy is really just an intervention utilized by physical therapists and assistants. So, to complement aquatic therapy, we also utilize traditional land-based physical therapy, right? So, normally, as land-based beings, we don't really function 24/7 in the water. So learning to do those things on land, being stable on land, learning to function on land is a must. So usually what we do sometimes we'll start in aquatic therapy and then move on to land-based interventions, or we'll do a mixture of 1 day in the water, 1 day on land. But yeah, it tends to be a mixture of both aquatic and land to achieve those goals. And that's the end of our presentation. Do you guys have any questions?
Thank you very much, Mr. Agven. Participants, I've opened the chat back up. So if you have questions, please type them into the chat feature, or if you raise your hand, we'll monitor the participants and we can unmute you so you can ask your question live. Do you need a referral from a doctor to go to the DHR Aquatic Therapy, or is it by itself?
I'm sorry, can you repeat your question?
Sure, I'd be happy to. Do you need a referral from a doctor to go to the DHR Aquatic Therapy, or is it just by itself a standalone?
So, like physical therapy, yeah, you would need a referral to be evaluated by a physical therapist, enter physical therapy, and then, of course, aquatic therapy would be part of the interventions that they would be using. But yes, yeah, you need a referral from a doctor.
And where is the pool at DHR?
So our facility is located in South McAllen. It's 2001 South Cynthia Street, close to McAllen Medical.
I'm looking to see if there's any other questions. If you have questions, please put them in the chat feature. This is the best part about being live, is you can ask the questions directly to the physical therapist. Those who watch this as a recording are not going to have the privilege of asking questions. Here's another question. If someone has been in bed for around 2 years because of an illness, for how much time would it take for someone to rehabilitate using aquatic therapy, and what method would they use to help the patient?
Well, a lot of that I feel would depend on why is it that they were in bed for such a long time, for 2 years. I'm guessing maybe some type of neurological issue that left very debilitated. But yeah, aquatic therapy would be the perfect environment to start strengthening that person. As I mentioned, being in the water, it unweighs you a great deal. So I would imagine that this potential client or person would be extremely weak, unable to stand alone or transfer to a wheelchair alone. They would need assistance. So yeah, the aquatic environment would be the perfect place to possibly have that person walk a little bit or perform sit-to stands, or yeah, slowly start getting into a more functional way of life.
Another question is, do you have this therapy for women who are expecting?
I'm sorry, the audio is breaking up a great deal, but I think I see one of your questions as, are aquatic therapy sessions more expensive on the patient than physical therapies? Um, that really depends more on your insurance. So there's some insurance that will cover physical therapy, and that's really what it would be billed under physical therapy. 100%, or you might have a copay, but that really depends on your insurance. Considering that aquatic therapy would be billed under a physical therapy intervention. Excuse me. Another question I see is, how do you control COVID in a pool with different patients throughout the day? So the chemicals we use to disinfect our pool, right? So pool can be disinfected through chlorine or bromine. Okay, chlorine tends to be very corrosive to not only clothing, but it can be very irritating to skin, eyes, hair. We use bromine, which is considerably less irritating to the skin and much less corrosive to clothing. Okay, so that alone is sufficient enough to kill the virus, as is with our current conditions and DHR policy. We utilize masks in the pool. So a client is encouraged or expected to use a mask, and as therapists, so do we. Our pool also has a UV filter disinfectant. So anything that passes through it automatically gets killed. Question, do you guys do therapy for pregnant women? Yes, we do. And I'm assuming that typically what we tend to see somebody that's pregnant for is back pain. So the aquatic environment would be very beneficial for them because of the unloading, and of course we want to do a lot of stabilization exercises.
Participants, if you haven't already, make sure that you go to the Google sign-in form and sign in for today's session. We'll wait a little bit longer to see if anybody has a last question as we wrap up the session today.
Another question I see is, do you guys do therapy for pregnant women that have problems with the L4? So L4 is a specific level of the spine. You have 5 levels in your lumbar spine. That's what the L is, the lumbar. So you have L1, L2, L3, L4, L5. So the L4 and L5 is the level of your lumbar spine that tends to have the most movement. And that's the one that tends to get injured more frequently, where we tend to have a lot more instability. So yes, we do therapy for that. Again, it would be a lot of stabilization, aquatic environment to unload for symptom relief.
I'm taking one more look to see if anybody's raised their hand to ask a question live. And if you have a question, you can either use the participant raise your hand feature, or you can type a question into the chat. I think that's all the questions we have. Mr. Agven, thank you so much for joining us today. We appreciate, yes.
I'm sorry, there was one more, Miss Alyssa Pena. Go ahead, Miss. You're muted.
You have to unmute her. Ms. Pena, you can unmute yourself now.
There, sorry, it wasn't working. Good morning. My students want to know if there is a mask in particular that you use since you're in the pool, if there's a different type of mask that's used with the patients or clients.
I'm sorry, I'm having a lot of trouble hearing you guys. The audio is very broken up.
Here,
I
let
couldn't
me
really
see
hear
if
the question.
let me see if I can ask for Ms. Pena. Can you hear me? Yes? Ms. Pena, maybe type it into the chat so he can see. Thank you. She's putting it into the chat. And I thank everybody for being so patient. With so many people on Wi-Fi and internet at one time, I don't think our world was ready for all of this. I've unmuted if you have a question, or you can put it in the chat. There you go. Mr. Agven, the question is in the chat now. But now I think you're frozen.
Okay, my students want to know, yeah, let's see the question. My students want to know if there's a specific mask used in the pool, given that is used in water. No, right now we're just using regular masks and as per CDC guidelines. So anything that's going to guard against those droplets that we naturally emit when we're talking or breathing is sufficient for right now.
I have a question. I understand from what I've read from the CDC that being in the pool is one of the lower risk ways of transmission for COVID. Is that true or not true, or you don't know?
Well, take into consideration the standards we use to disinfect the pool, the chemicals that we use, then we wouldn't really be leaving any virus on surfaces that we touched, because everything is naturally disinfected with the water. So the only thing that we'd have to worry about is anything that lingers in the air, such as those droplets that we were talking about. And masks, as per the CDC, seem to be very efficient and in controlling the amount of exposure that we have. So yeah, during the fact that you're washing out anything that would live on surfaces, I can see where they would say it's an extremely low risk. So I see a question on the chat. It says, how much money does patient have to pay for an appointment for pregnant women? Again, that would have to that would really depend on the type of insurance that person has. Might be where they might not have to pay at all, or they might have to have a small copay. But that really depends on your insurance.
I don't see anyone else with their hand raised, and I'll just give a minute more for anyone who wants to ask a question. Put it in the chat.
Did you talk about, Mr. Agven, about what a starting salary would be for your position? Like for the physical therapy assistant?
I'm sorry, I wasn't able to hear the question. Audio was very broken up.
What is the salary range for a physical therapist who works in aquatic therapy?
What is the starting salary for physical therapist assistants? That kind of depends on the area that you start. Fortunately for us, the area the Rio tends to pay a little bit more as opposed to the rest of the country. But I want to say the last time I checked, don't quote me. It's the last time I checked. A physical therapist assistant can really range anywhere between 35 to 65,000 per year, depending on, of course, what demographic you're working with, population you're working with, whether you're in a private clinic or hospital or health.
I see that there's a question about sending information, and we'll make sure that we get some from DHR so that we can send it out to you. That's a great idea. And Jerzy, earlier we talked about that. So you might want to watch the recording of this to see that. I do think we're getting to the time where we're going to wrap up the session. Yes, I'm going to send out a YouTube link to this recording, so anyone who wasn't able to join us live will be able to watch that recording. And I want to thank all you teachers and all of the students who have joined us today. You can get more information from the PATHS project website, which is pathcentral.org. If you have any other questions, you can email us at Region 1 Education Service Center. We're the PATHS project. And I want to thank you. Everyone, have a great day, and we'll see you again in November. Bye.